Hi, welcome to the Community Health Needs Assessment for Waterville, Maine. Here we have the methodology for this model. It's called the MAP-IT. It stands for Mobilize, Assess, Plan, Implement, and Track. We're going to involve stakeholders and local resources to create a coalition, and we're going to find out what the needs are for Waterville, what improvements can be made, and then we're going to create a vision for what the city could be, develop strategies to achieve this, and then we'll put it into action. And then finally, we'll track the progress and reevaluate to see what else needs to be done. Some of the disparities of Waterville: there's a large number of residents who are living on a low income. 16.5% make $10,000 or less per year, which is not very much. Lack of higher education, only 12% have bachelor degrees, and lack of activities for young adults and adolescents. Some of the demographics: the population is about nearly 16,000 as of 2005. About 4,000 people never married, 228 separated, and widowed about 1,200. It's mostly white race in Waterville, 93.9%. And as you can see, the rest of the races covered here: Black, Asian, Hispanic. The socioeconomic status for Waterville: elementary school, grades 1 through 8, about 1,400, and high school is about 883. College or graduate school, 2,300. I will add there's 2 colleges in Waterville. That is probably why there's a lot more in college there. Median household income is $33,000 with a poverty rate of 20%, which is pretty high on national average. And some of the top health issues for Waterville are obesity, drug and alcohol abuse, mental health, depression, physical activity, and nutrition. Some of the factors are poverty, access to care, access to healthcare insurance, transportation, and health literacy. Here's a graph that's showing the differences between the Kennebec County, which is where Waterville is, and Cumberland County in regards to the obesity. The left-hand side shows the percentage of adults who are obese, and the right-hand side shows how they rank within the state of Maine. And this graph shows the nutrition environment comparison for Kennebec in the green, Cumberland in the yellow, and Hancock in the blue. So Kennebec doesn't have as many grocery stores per its population as the other ones do. They definitely have more fast food restaurants and also low income. And this graph shows the physical activity for several different counties, including Kennebec, where Waterville is. As you can see, Kennebec's large access to exercise opportunities, but low physical activity. So people are out taking advantage of the resources that they have. Some of the statistics: 28% of the adults in Kennebec are obese. As I said before, it ranks 14 for the state in obesity, and 12.5% of adolescents in Maine are obese, and 15.1% of adolescents are overweight. Genetics determines how fat is stored and burned. Medical issues, Cushing's syndrome, other endocrine disorders, and age all are risk factors for obesity. Some other factors that are contributing to obesity is the family lifestyle. Sedentary, are they just sitting around watching TV a lot, not really getting a lot of activity? Also eating unhealthy diet. People seem to think that healthy food is more expensive than unhealthy food, so they tend to eat out a lot, eat fast food. Socioeconomic status is also a contributing factor, and lack of access to exercise opportunity. Some local resources that are in the Waterville area: for healthy living is the fitness centers such as gyms. There's also hospital-based classes. Many of them are free of cost, and they include how to cook healthy, diabetic cooking, Tai Chi, yoga. There's also the Kennebec Valley Action Program that supplies transportation to people who need to get to appointments and to get other places to support their healthy living. And the Alphon Youth Center is a center for kids to play sports and with coaches and so on. Some of the primary data that was collected for this project was the County Health Rankings and Roadmaps website. It shows the different rankings for different counties in the state. You can compare them to one another and see how your county rates. The Healthy Lifestyle Indicator Fact Sheet, Maine Shared Community Health Needs Assessment for Kennebec County, and also the secondary data collection, which would include the windshield survey and direct observation and interviews with key stakeholders. So in summary, we can tell that there is some exercise opportunities and healthy living opportunities for people in Waterville, Maine, but they are not taking advantage of them. We need improved funding for healthcare access and to educate the public on why they should be living a healthy lifestyle and what sort of rewards they can see from that. And that's pretty much it. So I am in support of a program that will help to make the city better, healthier, happier, all around. And that including primary care physicians and local hospitals and other resources to get on board and educate the public on how to be healthy and happy. And thank you very much.